Okay, I'm going to briefly talk about scar revision surgery. First thing to say, why do people consider scar revision? I think there are two reasons why one would consider scar revision. I would say most of the people that we see for scar revision are bothered by the scar. Sometimes the scars might be very tiny, but you as a person, you're bothered about it, in which case it's worth considering scar revision. Secondly, sometimes scars can cause functional problems. And for example, a scar around the nose may cause problems with breathing, a scar around the eye might cause problems with closing the eyes, or around the mouth it may cause drooling. So there are various aspects to it. Sometimes the scars cause pain. And then there are very specialist type of scars, special scars such as a keloid scar or what we call the hypertrophic scar, which is a thickened scar. These scars do become painful, itchy, so scar revision can be considered for various reasons. Now, I think the most important message that I want to put across to you is once you have a scar, you will always have a scar. So no matter what we do, we will not be able to get rid of the scar completely. However, what we can do is this. We can remove the scar, we can actually put the scar in a different orientation, which often may blend in with the natural skin creases and obviously make it look less obvious. The other important thing about the scars is any straight scar is actually noticed far more than a scar that's broken down. That's why when we do scar revision, often we change the orientation of the scar and we break the scar down, and we use various techniques for that. This could be using a technique what we call as a geometric broken line, or W-plasty or Z-plasty, call whatever you want. However, the idea is to break down the scar and to change the orientation. So after scar revision, we may have to do other procedures such as laser or dermabrasion, sometimes use creams, but generally the results of scar revision are excellent, but one has to be very patient because the final results can take up to 2 years. And this is what I tell my patients. After scar revision, we can almost guarantee you that as time goes, the scar will become less and less obvious. Whereas if you haven't done anything about your scar, that has been there for a long time, the scar will remain the same. So the results of scar revision are excellent, but remember, you'll always have a scar, it will be less obvious, and certainly aesthetically and functionally, you will have a better result than what you started off before the scar revision surgery.